Good day. We are the BSN 3A Group 3B from the University of St. La Salle presenting our study entitled Emotional Intelligence and Communication Skills Attitude in the Clinical Setting Among Nursing Students. I am John Isabel Miravalles. Together with me are Marc Matthew Miravalles, Alexandra Therese Modina, Kryzell Mugemulta, and Pete John Obrero. Emotional intelligence is the ability to understand and manage one's emotion and recognize others' emotion. In nursing, it supports effective communication, patient safety, and quality care. However, students often experience nervousness and difficulty expressing empathy during clinical exposure. This led us to examine its relationship with communication skills attitude. This study aimed to determine the relationship between emotional intelligence and communication skills attitude among nursing students. Specifically, we described the respondent's profile, assessed the variables, compared differences across groups, and analyzed their relationship. It is important for nursing education as it may improve teaching strategies and support the development of emotional awareness, empathy, and communication skills. It may also serve as a reference for future research.
This study was guided by Goleman's emotional intelligence theory, Travelby's human-to-human relationship model, and Watson's theory of human caring. Emotional intelligence was the independent variable, while communication skills attitude was a dependent variable, along with sex, year level, and clinical exposure. The study tested three null hypotheses: no significant difference in emotional intelligence, no significant difference in communication skills attitude, and no significant relationship between the two variables. We used a quantitative descriptive comparative design, which allowed us to describe variables and compare differences using a structured survey. It involved 248 nursing students from levels 2 to 4, selected through stratified random sampling to ensure equal representation. We used two standardized tools: the Shoot Self-Report Emotional Intelligence Test with 33 items, and the Communication Skills Attitude Scale with 26 items. Both tools were validated and are reliably tested.
Data collection was done through face-to-face surveys with proper approval. Participants were informed, guided, and given time to answer. Responses were then organized for analysis. We used descriptive statistics such as frequency, percentage, mean, and standard deviation. For inferential statistics, we used Mann-Whitney U, Krystal Wallace, and Spearman's Rho. Ethical considerations were strictly followed. Participation was voluntary, informed consent was obtained, and confidentiality and anonymity were ensured. In terms of sex, most respondents were female at 71.8%, while 28.2% were male, reflecting the common trend in nursing. Most participants were from level 2 with 97 students, followed by level 3 with 84 students, and level 4 with 67 students. Most respondents had exposure to multiple clinical areas, especially the delivery room, obstetric ward, and outpatient department, giving them varied clinical experiences.
The results show that nursing students had high level of emotional intelligence, with a mean score of 128.52. Scores were consistently high across sex and year levels, with the outpatient department having the highest mean, suggesting that clinical exposure enhances emotional intelligence. Student also had a positive communication skills attitude, with an overall mean of 3.97. All groups showed positive results, and the outpatient department again had the highest mean, likely due to frequent patient interaction. For emotional intelligence, there was no significant difference across sex, year level, and area of exposure, since all p values were above 0.05. This means that emotional intelligence is consistent among students regardless of profile. For communication skills attitude, there was no significant difference in sex and area of exposure, but there was a significant difference in year level, with level 3 having the lowest mean, possibly due to being in a transitional phase where there is increased workload and clinical demands.
Most importantly, there was a significant moderate positive relationship between emotional intelligence and communication skills attitude. This means that higher emotional intelligence is associated with better communication skills attitude among nursing students. In conclusion, Nursing students generally have a high emotional intelligence and positive communication skills attitude. Emotional intelligence is consistent across groups, while communication attitude varies by year level. A moderate positive relationship exists between the two variables. We recommend integrating emotional intelligence training in nursing education and strengthening communication through interactive learning and varied clinical exposure. Clinical instructors should provide feedback and debriefing, while students should practice self-reflection and improve communication skills. The study may serve as a reference for improving nursing education, clinical practice, and future research. We would like to thank our advisor, panelists, respondents, families, and the Almighty God for the support throughout this journey. Thank you, and that concludes our presentation.